الرحيم إنا أعطيناك الكوثر فصل لربك وانحر إن شانئك هو الأبتر.
So first, I will invite Professor Kanal Dr. Nasim for the for a few words regarding the update on the MRCOG 3 exam. Professor Kanal Nasli is FCPS, FRCOG, and MHPE. She's working as a professor of obstetrics and gynae and medical education adjunct faculty member in Shalimar Hospital. She has been an IRC member and then a fellow for the last consecutive terms. She took charge as a chairperson of IRC following her election in July 2022. She delivered a talk on 12th of August regarding the MRCOG statistics from the college. And today she will briefly update you regarding the delivery of the upcoming MRCOG Part 3 exam status. Thank you.
Assalamu alaikum. So mine is not a formal talk, it's just a continuity of the MRCG status update which I gave you in the last particular meeting. Just for the upcoming MRCOG Part 3 examination, Royal College has now confirmed the delivery status, and I wanted to share that with you before we commence formally with the two talks of today's session by Dr. Waseem Lodhi. So the MRCOG Part 3 examination, the next exam is due from 7th of November to 15th of November, and we know that it is being supported by UK, India, Egypt, UAE, and Singapore. And assessment for training has already been closed on 8th of August. So the application status will open in two windows. The first window will be for UK residents, and for MTI trainings, Hong Kong or Singapore conjoint training programs. And that will close on 5th of September. That will be followed by opening of the second window in which the candidates from Pakistan and all other eligible candidates will be able to apply. And that opens on 7th of September 22 and closes on 12th of September 2022. I just wanted to clarify here that applications will close once all the available seats are filled up even before the closing date. So it's important to register in time. And as far as the mode of delivery is concerned, now it has been confirmed that the status is going to be a face-to-face examination in UK, Chennai, Cairo, Abu Dhabi, Kolkata, and it's going to be an online in Singapore and Hong Kong. Thank you very much. With this, I invite today's chairperson, today's chief speaker, Dr. Waseem Lodhi. Dr. Aruj will formally introduce him to you and followed by his talks.
Thank you, Professor Nasli. Thank you for the sharing of your knowledge. So moving on to our formal second talks for today by Dr. Waseem Lodhi. Dr. Waseem Lodhi moved to UK after his postgraduate training in Pakistan. He did CCT in obstetrics and gynae in UK. His special interests include outpatient operative staroscopy and medical education. He is involved in various teaching activities with RCOG and internationally. He is an undergraduate and postgraduate examiner. Currently, he is a regional champion for MTIs in North Central and East London region. He is involved in the specialty training recruitment interviews as a panel member from UK. He's a mentor, he's a trainer holding courses in interview skills, basic practical skills, TPH management, non-technical skills, and the human factor contribution in making errors. He has co-authored many papers and a video book, How to Perform Operative Procedures in Obstetrics and Gynae. This book won the BMA Best Book Award in Obstetrics and Gynae category in 2021. Passionate about creating opportunities for professional development of colleagues in UK and Pakistan. Thank you so much, sir, for your talk today, for coming over.
Assalamu alaikum, everyone. And good morning. Thank you very much for giving me the opportunity to talk today. And I would especially like to thank Professor Nazli as she has taken this initiative to bring all this up-to-date information to the trainees in Pakistan. So as we have mentioned that we have got 2 talks today, so I will give them back to back. And then afterwards, we will take the questions at the end. Okay, so I will start with the Medical Training Initiative Scheme. So can you raise your hand if you are aware of this MTI scheme? You can do it in the chat box. Dr. Aruj, you can have a look at it and see if anybody raises the hand.
So there's one doctor, Hibamat, she is aware.
Okay, so it's very disappointing already to start with. So this is where the benefit of this talk comes in, that we will introduce this to you because unfortunately this scheme is not very common among Pakistani trainees. So in UK, we are getting a lot of people from different countries who are coming for training in the UK through this scheme of the Royal College. And unfortunately, we have a very low percentage of Pakistani candidates applying for this. So as you have heard my introduction, I'm very passionate about this teaching and training thing. And the reason for that was that many years ago when I was in training, I was desperate to get training from UK, and this was an era before internet, and it was very frustrating, and there was no support to me, and I just had to stumble, fall, rise, and then keep going through that. So I thought that, okay, I would like to help my fellow countrymen and women who would like to get an experience or training from UK. So I should do something about that, and that's where this stuff comes in. Right, so this is my hospital. As you can see on the map where I am currently based in London, and North Middlesex Hospital is one of the busy inner city hospitals. It's not a tertiary center, it's a very big district general hospital with approximately 6,000, 6,000 deliveries. As Dr. Aruj introduced that I'm the MTR regional champion for North Central and East London region. So basically RCOG appointed regional champions a year ago, and the purpose was to provide mentorship and support to MTIs who are coming to UK. And I've taken some of the slides for this presentation from RCOG's MTI presentation that they're going to promote it among the applicants. Right, so this is London. You can see it's a beautiful city and it might ignite some interest. If you like to travel as well, you might want to travel and you want to see new places and you want to come to UK. So obviously UK has, you might not have MTI posts just in London area, and you will be able to get it in different regions. But it would just give you a flavor what you will be able to see when you are in the UK. Now, a lot of people, they are concerned that if they go over there, so how will they be able to function? So as you can see from these photos that we have a multicultural workforce, and there are people from almost every country, and we all are able to work harmoniously. In the top photo, these are just the consultants, and in the bottom left, we have got trainees, midwives, nurses, healthcare support workers, and you can see they seem to be coming from different parts of the world. and the other right lower photo shows you our different trainees. So as you can see that we have a very workforce and we all work harmoniously. So what is MTI scheme? So MTI scheme is a scheme organized by the Royal College of Obstetrician and Gynecologists, and the purpose of this scheme is to primarily train overseas doctors who are international medical graduates for 2 years in the UK NHS hospitals. So RCOG sponsors the successful candidates for GMC registration and liaises to obtain a Tier 5 2-year visa. So first of all, I would just briefly mention that in order to work in the UK, you need to have registration with General Medical Council. It's just like in Pakistan, you need to have registration with Pakistan Medical Council, Medical Commission or PMDC. So there are different routes to GMC registration, and I think you had a talk last time by Dr. Rabia, and she mentioned that. So primarily there are three. One, you pass PLAB examination. Second, you do full MRCOG, and then you are able to get exemption from MRCOG. You get exemption from PLAB examination. And third is that you get sponsored by one of the bodies in the UK. So you get exemption from PLAB. So for Obs and Gynae, it's the Royal College of Obs and Gynae, which is the sponsoring body. And they are the ones who will be sponsoring. So you will not have to go through PLAB examination and you will be able to register for GMC registration. The main important point is that you should not have attempted PLAB before. And you get a work permit for 2 years. So you come and work in the UK. Previously, people had to go back because that work permit cannot be converted if you change jobs or at the end of 2 years, you decide to stay in the UK. Now you are able to do that. So when you get appointed to MTI scheme, what happens is that in the first 3 to 6 months, you would be working at second year trainee level. So it's like in UK, you move on to a registrar post after 2 years of basic experience in Obs and Gynae. So if you're not familiar with that, if you look at the training pathway on the Royal College website, you will be able to understand that better. So first 2 years, you work as SHO. So essentially you are first on call. Then in year 3, you move on to a second on call, which is the registrar or junior registrar post. Now, what happens is that MTIs, when they come from different parts of the world, it is difficult for them to adjust into the system immediately because it's a cultural shock, it's a different health system. So what is recommended is that you can start as an SHO in the beginning. It depends how quickly you settle down within that environment. So it could be that within 6 weeks you will settle down. You can take 3 months or you can take 6 months even. So I came through a similar sort of scheme. It used to be known as Overseas Doctors Fellowship Training Scheme at that time. And people used to be appointed as registrars directly. And it had been very successful, but there have been issues because especially if you go to a very busy district general hospital and you are the only registrar on call and you are new in the system, then people used to struggle and sometimes they had to be demoted to go to the SHO rota until they become comfortable with the system. Because in UK, when you are on call, so in smaller district general hospitals, there used to be only one registrar who would be on call at night or after 5 o'clock at night. So you can see that if you are absolutely new, then it would be very difficult. So however, situation has changed now. And now what we tend to do is we tend to get new MTIs, give them opportunity to settle down by putting them in SHO post for 3 to 6 months. Then depending on their performance, if they are ready to step up, then they move on to the registrar rota. And this is equivalent to basically the trainees in the UK as well, so who are in the UK training system. However, the main problem comes that in Pakistan, you might have worked for 5 years or 6 years in Obs and Gynae, and if you are an MTI, when you go there, you might think, okay, this registrar is half my age or half my experience, and some people they find it difficult. However, you should look at it positively that you are not being burdened with all the responsibility. So there are people who are able to help you out, and you gradually transition into that system. And also the other thing is once you are a registrar and you have an SHO who comes and sees you for something they have seen in A&E. So administratively, sometimes you do not understand what is happening if you have not worked in that SHO post yourself. So this is where it helps. So the expectation of the MTI scheme is that you get the opportunity to work in the UK. So it would improve your chances of passing MRCOG Part 2 or in Part 3 exam. And most of the MTIs who come, they are able to work in UK, and you are working as at a paid post. So you are being paid for that. And then at the end of within those 2 years, you are able to pass your MRCOG exam, and then you can go back home, and then it will benefit your home country. So uh, how does it offers to what does it offer to international medical graduates? So basically, as I mentioned, that it's a paid 2 year training course. So there is focus on training at intermediate level, which is ST3 to 5 level, and you get GMC registration, lab exemption with that, and you get a work permit for 2 years, what is called Tier 5 visa sponsorship. And then you get guidance and support. It gives you the opportunity to be able to practice your skills, which are needed for Part 3 exam primarily. And it has been seen that people who are working in NHS, they find it much easier to pass MRCOG Part 3 as compared to people who are from other countries who find it easy to pass Part 2, because Part 2 is theoretical exam. So a lot of people from overseas, their theory is very strong, but where they lack is basically the way the NHS works and what to do in a particular scenario when a task is given to them during Part 3 exam. And end of the day, you are able to develop new networks, and it would benefit you, your country, and UK as well. So who's eligible to apply for MTI scheme? So interestingly, it's a very simple scheme. There is no difficult entry process. Anybody can apply. And then if you only one person, I'm like really surprised to hear that only one person has heard about MTI scheme. Because I believe a lot of people might be thinking that, okay, I want to go abroad to get training in UK. So if you want to do that, you have to yourself make an effort. You have got internet now. You can go on internet. You can go on Royal College of Obs and Gynae website. You just Google, it comes up, and then you can find information. So it could be that people are not interested in leaving Pakistan and they want to work over there and train over there. So one of the biggest benefits, which I think that we, in my era, we used to have was that people who are working in Pakistan, they were surgically much more stronger as compared to when you are working in UK. When you're working in UK, your communication skills, they are greatly improved, and your governance skills, you think about risk management and all those things, but clinically, surgically, so you are not as strong, because in Pakistan you might end up doing 10 hysterectomies in a day, but in UK you might end up having one hysterectomy on your theatre list in a day. So anyway, coming back to this, that are you eligible to apply for MTI scheme? So you should have passed MRCOG Part 1 or MRCG Part 1 and Part 2, but you should not have passed Part 3, because if you have attempted Part 3 and you have passed it, then you would be able to get exemption from lab on the basis of MRCOG. You should have at least worked 4 years in Obs and Gynae, but no more than 8 years. Previously, it used to be 10 years, but now they've reduced it to 8 years. And you should be working in a substantive post. It's not that you're doing locums here and there and not in a regular permanent post. You have to pass the English language test, which could be IELTS language, or it could be a professional English test, which you should have a score A or B in each testing area. A lot of people, they find IELTS exam a bit more difficult. So if you find that, then in that case, you can consider going for OET exam as well. And that's much more simpler as compared to IELTS. You must have applied to Royal College for assessment of your training, and they should have assessed that, and then they should have told you that you are eligible to take MRCOG Part 2 exam. Then you would need two professional references, one from your current supervisor and then a head of department. And these are submitted directly. It's not that they will do a letter and then give it to you and sent by them, sent by you to RCOG. Now college has introduced that you should have completed a log of procedure signed and stamped by head of department and clinical supervisor. So if you are thinking about it, then you need to start collecting the data, how many cesareans you have done and what type of cesareans were they, and dates along with that, and what was your role, were you assisting, were you the primary surgeon, and similarly instrumental deliveries is a big thing. So we want to make sure that we are getting people here who are able to do instrumental deliveries, so you need to have some background skill for that as well. It's in general, there are a lot of things that you have to collect this data as part of your training. So just keep it in one place and get it verified by your head of department and clinical supervisor. Then obviously you need a valid passport, and most importantly, you should not have rights to work or reside in. Means if you have got a European Union passport or a UK passport, then you won't be able to apply through this scheme. And as I mentioned previously, that you should not have attempted PLAB test, because once you attempt a PLAB test and fail it, then you will not be able to get exemption from PLAB examination. So either do it wholeheartedly and pass it, or don't attempt it, okay? And also you should not have been on a tier 5 visa, which I have told you that it's a work permit visa within last 5 years. And then GMC also wants doctors to be in medical practice for 3 years of the last 5 years, and including the most recent 12 months. So clinical observerships, attachments, they do not count. So you should be actually working regularly. Then RCOG suspended the scheme in 2021 and 2022 because of the COVID. So there was a big backlog of applicants, and the hospital trusts which appoint these candidates, they were not really taking new applicants. As a result, RCOG wanted to clear the backlog of people who have already applied, and I think there were just over 100 people. So this year, the college has decided that it would open that for the next year's round. So next year's round means that they are going to do appointments for post starting in 2023. So by Monday, 10th October 2022, the application will be available, and then you have to submit application form, supporting evidence, logbook, references together. Then by Monday, 31st October 2022, your assessment of training application to the Royal College for next year should have been approved. And then Friday, 25th November, this application closed for MTI 2023. So what happens is that once the applications are submitted, they are assessed by MTI assessors, which are in the UK. And they basically then shortlist candidates based on that. So usually RCOG gets about 250 applications, and out of those, 200 are deemed to be satisfactory, but this might be incomplete, so they get rejected. And then once MTI assesses, they have shortlisted applicants, then it goes to the IRC panel for interviews. And for Pakistan IRC, it's Professor Nazli, if you're not aware of that. And prior to her, it was Professor Arif Jamal. Then IRC panel, they then decide to interview and then further shortlist candidates out of that. And then a final MTI waitlist is announced. So we end up having about 100 applicants out of 250. Now imagine these 250, they started from all over the world because this scheme is open to everyone in the world who is able to fulfill the criteria. And then at the end, then once the final waitlist is announced, then a Royal College matches these training posts by these candidates based on their score. And then if you have got highest match score, then you will be able to go first. And it depends which trust has applied first. It could be that not everybody has applied in the beginning. And there is no guarantee that, say, if you want to work in London, you might not be able to work in London. You might end up going to Belfast. You might end up going to Manchester or Scotland. So you need to be aware of that. A lot of applicants who are applying for MTI scheme, they are coming from Nigeria, a huge number of applications, Egypt, huge number of applications, Sri Lanka. Interestingly, Sri Lanka has a very organized system for their post-graduation. They have an agreement with the General Medical Council. So in order to appear for Sri Lankan postgraduate exam in Obs and Gynae, their candidates, they have to work in UK, and on the basis of their primary medical degree from Sri Lanka, they are able to get exemption from PLAB, so they have to come here. But there are people who are also coming through MTI scheme, and they basically use that opportunity not only to be on MTI scheme, but also to be able to complete their requirement for their home country postgraduate exam. So this is the plan for 2023. So it's still not too late. If you are thinking about it, then please bear in mind about these dates and spread the word as well. So I would really like to see a lot of people coming from Pakistan as well. Another thing is that I once inquired from RCOG that can't we choose, like say, if you want to go to London area, yes, you can put your request if you have got any strong family reasons, but usually the RCOG will not entertain that because end of the day, it will be based on your score. So if your score is high enough that you are able to work in London or a big city, then you will be able to go there. If your score is not big enough, then you might end up going to a smaller district general hospital. And it could be anywhere in the UK. So what are your chances of selection? So as I mentioned that we have about 250 applicants, of which 200 are eligible, and the top 100 go for the interview, and then we end up having about 70 wait listed. So in last year, I think we had just over 100, and that was because of the backlog, the COVID backlog, where trusts they were not making new applications. So in general, 40 to 50 placement posts are received from trusts each year, and number of posts is dependent on local spare ST3 training capacity. Because bear in mind that you can't just keep on having people filling in the rota, because you need to have a certain number of trainees in a department at one time. So say if you were supposed to get 2 ST3, which are the junior trainees, and at the last minute, they decided to go into research or take a break from their training, then you have 2 empty posts. So it would give you an additional 2 posts, and then your department can apply for them. So it's all, you just have to keep it in balance. How many are in training? Unlike Pakistan, where sometimes you can have a department full of numerous trainees. It's a very competitive process. People are coming from all over the globe. It could be Indonesia, it could be Malaysia, it could be Singapore. So the college is really strict about that. So you have to be good in filling in your application forms. And that is one of the things that we can probably talk in future, that you need to sell yourself. So we as Pakistanis, I think we underestimate ourselves and we don't sell ourselves, and we're good not salesmen. So we tend to underplay with you might have done a lot of things, but you think, okay, probably it's not required for this application, and you're not going to enter anything on the application form. And until you enter on the application form, the person who is assessing you will not know. And you can apply for MTI anytime. You can do it after your part one, once your training has been assessed for part two. It could be that you have already passed part two MRCOG, but you have not still done MRCOG part three, and you are still eligible. You can come, and you will be at equal level with both part two and part three applicants. It's not that RCOG will favor one or the other. And you should be at UK specialty training 2 or 3 level to be able to step up in 3 to 6 months window. So if you are working at a very junior level and you haven't had much of an experience, then you will struggle, because once you move on to the registrar post, there will be a lot of responsibility in the UK, and if you are not prepared, then it will be difficult for you to function in that system. Then you need to have realistic expectations of MTI training. A lot of people, when they come for MTI training, they think as if they've got a specialized subspecialization training or a fellowship training, they will come and they will do that. Unfortunately, it's not like that. You go with the core trainees at ST2 or ST3 level. So as you step up, because you would have previous experience from Pakistan as well, you can reach ST5 level, which is the 5th year of training. And we are talking about people who have started just after their house job, and house job here is not like that you have done 2 years in Ops and Gynae, like in Pakistan. So here it's called foundation year 1, foundation year 2. Foundation year 1 is practically just like observership, I would say. Foundation year 2, you have got 4 monthly rotations. So it is slightly different, and you don't get much experience with that because you're working at a very junior level. So you should not think that you are going and you will get gynae-oncology training or urogynecology training only. Yes, it could be that you are able to work with a consultant who's urogynecologist, and or you are in a unit which has urogyne opportunities, and you are able to get experience for that. But don't come with that frame of mind, because a lot of people, they come over and they feel bitterly disappointed, because I've seen we had a trainee who came from one of the Middle Eastern countries, very experienced, and he thought he would be getting experience in advanced laparoscopic surgery. And when he was doing labor ward, so he used to feel frustrated because he thought that he's senior enough not to do labor ward and to do laparoscopic. But you bear in mind that you have other trainees, senior trainees who are in the UK health system, UK training system, who are doing their ATSMs, which are these specialized modules that you do for your completion of training. So he ultimately decided to leave the training. And then end of the day, the aim of MTI training is that you learn and then you return to your home countries. Though some people, they decide, okay, they don't want to go back. And then once they finish the 2-year MTI training period, then they choose to go back. Another issue that we used to have, a lot of people, they would just drop out. As I mentioned, that they didn't like the setup, or because of family reasons, they end up going back. So end of the day, it just wastes a lot of resource, because hospitals, they pay for these posts. And if they've done a lot of effort and then suddenly a candidate says, or a trainee says that I am not happy to continue with MTI, I will leave. So it's a big loss for the hospital and for the RCOG as well, because a slot gets wasted. So please do think about it. It's a great opportunity, but come with an open mind. So how will it benefit you? So it will give you opportunity to get training in the UK. You are getting salary, which is equivalent to an ST3 level, basically a registrar who's working in the UK. So it helps you to improve your communication skills, English language skills, team working skills, negotiation skills. Because how many of us, when we are working in Pakistan, we have that sort of opportunity. Midwives are non-existent. And you rarely see pediatricians or neonatologists. And also over there, if a patient is not agreeing with you or asking you difficult questions, you can just say something to them and then, okay, don't ask me too many questions and go and see some other doctor. But here it doesn't go like that. And also patients, they can ask you difficult questions because they've Googled if a new treatment has come up, or some new modality of management is available, and you have to keep your skills and knowledge up to date as well. And the people who go back, they have new skills and ways of working because they worked in a multidisciplinary team working environment, and they tend to practice evidence-based medicine. Not that my professor has told me this is the only way to do it, which unfortunately happens in Pakistan. I'm sure you will agree with that. Then, yes, you are able to pass your part 2, part 3, and as you can see from this slide that MTI trainees pass rate is similar to UK trainees, and that's because once you start working in the same environment, then you know how the NHS works, and then you would be able to answer the questions better when you are in the exam. And end of the day, it improves your software experiences as well. So you're more aware of patient safety, not that Allah ki marzi the je bas ho gaya. You tend to investigate and find out why this happened. You think of risk management. If a swab is left in the abdomen, in the vagina, then you have to investigate and find out why it happened. Not necessarily it's because of negligence. It could be that you were tired, there were systemic problems, there were distractions and all that. So this is a talk about non-technical skills, and we can talk about it sometime. Then clinical governance, and also you contribute to development of local guidelines and postgraduate teaching, and then you train people back home who are the future of ops and gynae. So I think I've covered almost all of these. That it's a 2-year training at ST3 to 5 level. You come in at ST2 level, then step up to ST3 within 3 to 6 months. And then if you are experienced, people will treat you differently, because end of the day, once you have settled down and you are able to perform independently, safely, people will be appreciative of that. So it will not be that we don't have hierarchy, unfortunately, here. And even people, they would call their consultants by their first name, and which sometimes is annoying, because you don't expect it from somebody very, very, very junior to you. But that's how it is. That's how the system is. And then you get, you are assigned an education supervisor. You can discuss your training issues with them. Then you fulfill RCOG's training matrix competencies. And you get a lot of exposure to labor wards, cesarean sections, acute and emergency, gynae. And as I mentioned, that you will not be able to do large amounts of surgery or carry out complex or specialist procedures. MTI scheme is not for that primarily. Okay, it's not a postgraduate, it's not a subspecialized training. And then if you want to pursue, if you have completed all the requirements, then you can register for ATSMs, which are advanced training skills modules. So these are basically not like subspecialization. It's like you can have that, okay, I've got the special interest in that. Like I haven't done a subspecialization, but I have done ATSM on hysteroscopy, and I have a special interest in outpatient operative hysteroscopy. And that's where then you look at where the market is, and then you develop yourself accordingly. And the visa is for 2 years. At the end, you have to come off that visa, go back. It's not an excuse that you haven't passed part 3 yet, or you haven't completed your ATSM. So there's a lot of information on our RCOG website. So this is the link for that. So just make an initiative. We cannot spoon feed you. If you are interested in getting training abroad, then you have to find a way. There are a lot of opportunities, and people who make an effort, they will be able to find all of them. Okay, so the RCOG MTI office email is there, and I hope you will all consider that. Right. Okay, so I will stop this here. And Mr. Nazli, anything you want to say before I move on to the next one?
Thank you very much, Dr. Waseem. This was a very, very enlightening talk. And I think you better carry on with the next talk, and then we'll take questions and answers. We have a couple of questions, but I think we'll address them after your second talk.
Okay, thank you.
Thank you so much.
Right. So I thought that I will also add this topic, Introduction to Interview Skills. And the reason I added this was that when I came from Pakistan, I was really hopeless in interviews. I was a very shy person. I would not be able to speak up. And it's just that we tend to shy away basically from wherever you have to express yourself. And then you need all these skills for your getting a job. And this is something which is going to help you all your life. So I learned it the hard way. So I thought at least I can introduce it to my juniors. So hopefully you will find it useful. So when you are going for a job, there are a lot of people with you. So who will be starting a job? Not everybody will be able to get into the job because there will be one job and there might be 10 applicants. So those who are good in expressing their skills, expressing their competencies, expressing their knowledge, they will be able to get the job unless there is some nepotism and people have to appoint somebody. That's a different scenario. But if you are able to shine, and that will be by preparation and by knowledge of that. So I have a special interest in this as well because I struggled myself. So I'm really passionate about that. And also because when I was a senior trainee, I used to sit on interview panels with my consultants at that time for these applicants who are applying for registrar and SHO jobs. And I saw that we used to have a lot of Pakistanis at that time. But they all used to struggle with interviews. So their application forms were poorly filled, and then in interviews as well, they were not performing very poorly. So I thought that, okay, I need to do something about it. So I started organizing interview skills. And initially it was just word of mouth. I would just inform some people and they can spread the word. But unfortunately, a lot of people who come to UK and they are not working, uh, they might not be able to get that information. So we had to rely on that because it was like a feasibility type approach. So we didn't have funds to advertise it. Uh, and then we gradually introduced these interview skills for people who are applying for training posts in Obs and Gynae at year one training level, or people who are coming from overseas, and because now they are able to apply at ST3 level. And that's something I would just mention, that if you have got a UK passport, if you have got uh, uh, or even if you don't have a UK passport, but you have a GMC registration, do you know you can apply for a year 3 training post directly? Every year the applications they open in usually November, December. This year also, I think they've just opened up or they are opening up. So do keep an eye on that if you are interested. Though your chances would be less if you have never worked in the UK, because there is an interview process and then you would perform better if you have worked here. Right, so that's just the background. Sorry, I just tend to drift away from the topic. And I've been examiner for part 3 as well. So, and both for undergraduate as well and postgraduate. So I just used to observe people, how they give interviews. And I learned a lot myself we used to have University College London medical students. And although they might be like 1/3 of my age, I used to look at how they answer questions. And it's really interesting how they bring in or they twist the whole interview and they take it to the direction which are their strengths, and they perform well as compared to us, that we dig our own grave. And then when I'm saying we, it's most of the overseas people, we just get into trouble and then perform poorly in the interviews. So these are different courses that I've been doing. So I started this way back in 2010. And you can see that I have been holding these interviews every year, interview skills course almost every year. It's just because of the COVID, then it became a bit disorganized and we had to do an online one, which is not the same. Because I like face-to-face things and I think people learn more by that. Here, this is a book that a lot of people who are preparing for ST interviews. By ST, I mean specialty training interviews. That is, people who are applying for training position in obs and gynae. Everybody is reading this book. Interestingly, it's a generic book. If you open it, it will just give you these 120 medical interview questions. And when I had the candidates who are coming to my courses, they used to have this book and they used to hide it from others. And if you look or ask people, then you will find everybody had the same book. So the question is that, okay, they all have the same book, but they don't perform well in interview, or they perform differently. And the reason for that was that you have to tailor your questions. They give you a generic question, and I will talk about that later. But then you have to tailor it with an example, with something that you have done. And that will make your answer unique and it will show the passion. And this is just like when I prepared for my interviews, when I went for that, I was so sure that it's possible they will not give me the interview, they will not offer me the post. And the reason for that was I knew I was very, very well prepared. And there are times when I failed and I knew that I was not prepared at that time. Right. So interviews are an integral part of being a doctor. So you will have to go through that all your life, unfortunately. So the selection process starts from job application form. So you need to know how to fill in job application form. And that's also another thing is if you have already got GMC registration and you're applying for UK registrar or SHO position. So there is a standardized form and you need to fill it in a particular way. Because if I'm scoring it, so I will not be able to give you any marks. Like recently, we were recruiting for registrar posts and somebody from Pakistan had applied who's working in Ireland. And she emailed me, I met her on one of the courses and she said, I'm very interested, I've applied this and that. But then when you look at the application form, there are bits where she has not written anything at all. And the problem is if I'm doing scoring based on those standardized questions, so I cannot give you any point for no response. So if she has left that blank or they ask a question, have you done this? And she says, no, I can't give any score for that, unfortunately, because tomorrow if somebody raises an objection and I have to justify, I should be able to show that this person has written something. So it is important to fill the application form properly. And then the other important thing is remember the questions, they remain the same. When you apply for medical school here in UK, they will ask you similar questions. And even when you apply for a professor post here in UK or a consultant post, the questions will be the same. With your experience with that level, the answers, they tend to change completely. And this is one of the things that you continue to develop with that as you become more senior, more experienced. So whenever you are preparing for the interviews, the first thing is to look at the job specifications. So the advertisement which has been there, so they would have put essential criteria that you must meet to apply for that. Like say you should have MBBS. So if you don't have MBBS, so nobody will shortlist you. And then there is also desirable criteria. So you have to, if you have done those things, like say any extra degree or something, any extra courses, so that would be useful because it would give you some brownie points. Have an updated CV. A lot of us, we don't even know how to write a CV because if I look back, I'm not sure if in your medical schools now you guys get an opportunity to have sessions how to write a CV. When I was in Pakistan, there was no guidance at all. And then if your CV is more than 10 pages long, then you need to have a one A4 page executive summary in the beginning, because bear in mind that not everybody would have the opportunity to or the time to go through your 15, 20 page CV. So they would just look at your first page and then look at that executive summary. It's easier if you are at a junior level because you don't have much to write. But if you have a lot and you have done a lot in life, then it would be useful to have that executive summary. And also read your CV and application form before the interview. A lot of time we think, oh, I know my CV. And when somebody asks you a question, so you fail miserably. I would give you an interesting example. And way back in 2011, I applied for a job, and for a Middle East, basically, at that time. I was just completing my post-graduation here at this CCT at that time. And I didn't even read my didn't read my CV. And they asked me a question about one of my publications, and I had completely forgotten about that because it was one of my earlier publications. It was very embarrassing for me. So make sure that you read your application and CV. And don't just go for the interview just for the experience. This is what I did. I just went for the experience, and you feel bad. And to this date, even after 11, 12 years, I've not forgotten that I did really poorly for that interview. So if you are going for the job or going for that interview, go with full preparation. Have some practice sessions. Now it's great that you can either have your friends, so you can ask them to ask you questions and then have mock sessions with you. They can give you feedback, or if you are one of those shy ones, you don't want to um, ask somebody else to do that, you can put your phone as well. And also, one of the other things is that it could be that you have got 2, 3 people applying from your own department. As Pakistanis, we don't want others to know, and we are very secretive. We just want to make sure I get the job. So I'm sure you all do that, isn't it? So do these practice sessions, record your interview skill, and especially if it is an online interview, because you need to have some practice before that. And when you go for the interviews, arrive well before the time. So don't arrive 1 minute or 2 minutes before the interview, because if the roads are busy, you get late, you cannot find the place, you will be all flustered and stressed out, and you will not be able to perform well. So you can wear anything that you like, but look professional. It should be comfortable, because then you would feel comfortable yourself. And you should not have excessive makeup and not like hair all over the place. And you just have to look up a professional and don't go in jeans, especially if you're coming for interviews in the UK. A lot of people who come from overseas, because say in Pakistan or Middle East, people who are wearing jeans, they just think, okay, it's trousers. So it's Levi's trouser or some branded or a designer jeans that they are wearing. But here, jeans means very informal dress. So you cannot just wear it to work. Also, I've seen people who come for MRCOG Part 3 exam, and there are especially our females from Pakistan. They are wearing suits and they are wearing trousers for the first time in life. And you look at them and you can see they are uncomfortable in that. There is no harm if you want to wear a shalwar kameez, it's absolutely fine. If you're looking professional, nobody's going to judge you on what you are wearing. However, if you are wearing something which is not comfortable, you internally are not comfortable, you are wearing a coat and then you are pulling it down here, all that. So you can see it would distract you as well. It would distract the examiner, and you yourself will not feel confident. So wear anything. I had a consultant, very senior consultant who's retired now. She wore sari all her life, and she said to me that when I came 30 years ago, 40 years ago, people said to me, you will not be able to progress in UK if you are in this attire. So she was an Indian woman. She used to have a choti and then sari, and that's what she did all her life. And she had a huge, huge private practice as well, and a very popular and famous OBGYN. Then body language, appear confident. Don't come shaking already, trembling, as if the other person is going to slaughter you. Overcome your shyness. We Pakistanis in general are very shy. And I blame myself as well. I'm also one of you. And still, they say that if 2, 3 Indians are sitting together, they will find something common to chat about and they will inquire about that. If Pakistanis are sitting there, they will not even look at each other and they will not try to make a conversation. And this is my observation as well, having lived outside of Pakistan for almost 23, 24 years, that this is true. Then do not sit on the edge of the chair. I mean, there are a few things about this, that hopefully if I get an opportunity someday to run a session in Pakistan, I will show you what I mean by that. So don't just go on the edge of the chair, because when you're sitting like that, you are anxious. What I learned is that if you are sitting on a chair with your back against the back of the chair, hands on the side, then you will feel much more confident and comfortable as well, and your answers will reflect that. Also, if you have got fiddly fingers that you are doing that, as you say, "Kadake nikalte," so try to resist that. And if you are one of those whose hands are going all over the place when you start answering, that's very distracting for the interviewer. So one tip for that is that just lock your fingers like that and keep them in front of you. That way you will not be able to do all this, okay? Or some people, they keep doing this, they keep doing that. So it's just these things you need to avoid when you go for the interviews. Also, do not lean over the table, because if you've got the interviewer across the table, you don't want to go just like that to sit on the table as if you are on their face. There has to be some personal space, and you should be away from that. And also at the same time, when you are on a chair, don't be like that completely. Then don't have restless legs. And this is something I find very interesting, that whenever I'm sitting for any interviews or even for MRCG exams, I just look at people, because it would tell you how anxious they are, that they're moving their legs, their feet, they are just constantly moving them. So again, like I said, that cross your fingers, same, you can cross your legs and keep them together so you don't move them. Then the other thing is maintain eye contact with all the interviewers. Sometimes you have four people sitting in the interview panel, and you are just focusing on one. The others, they get distracted because you are just looking like that. You never look in that direction. So you have to keep looking across just to make sure that everybody feels that you are answering to them as well, and you are communicating with them as well. So there are some typical questions in interviews. Again, these are those questions which there are a lot of questions. I just picked a few of them to give you a taste of how it is. Most of the interviews, they start with this: tell us about yourself, or why have you applied for this job? A lot of people, they think that, okay, it's a trick question. It's not a trick question. It's called icebreaker question. And the purpose of asking this question is, you know yourself. So they're giving you the opportunity to talk about yourself. It puts you in your comfort zone. And then even if you are anxious, you would be able to settle down, and then you would gain confidence to answer more difficult questions later. So there is no trick with that. And this question is asked in different ways. Tell us about yourself. Why should we hire you? Why you have applied for this job? And take me through your CV. So it's essentially the same thing. Then there might be a clinical scenario question. They would give you, say, a PPH scenario. They would give you a preeclampsia, eclampsia scenario, or some sort of emergency in obstetrics or gynecology for questions. And this is just essentially a test of your skills, basically. Then invariably, all the interviews, they would ask you about a quality improvement project. And primarily in UK, we have this audit. Now, this audit is different from the audit that Pakistani banks do. I'm sure you remember that there is a day when banks are closed. Why? It is an audit day. So in UK, audit is different. Audit is basically a process where you are comparing your practice against some standard. Like, say, if RCOG has said that you should be doing this, so are you doing it in your department or not? And then you look at that and compare your practice. I strongly recommend people that those especially who are going for Part 3 MRCOG, you should consider getting yourself involved in an audit. A simple audit which I would recommend is that look at filling in of cesarean section consent forms. So if you look at RCOG, there is a guideline. There is a consent advice for cesarean section. So if you look at that, it would say that, okay, you write elective, emergency, whatever cesarean section is, what is the indication for that, what are the risks, all that. Even like, okay, patient name was written, date of birth was written, people signed the form, they provided details, they provided the copy of the form to the patient and all that. So you can do it. It could be a prospective audit. Or you could choose anything in your department, and you don't have to do hundreds and hundreds. You can choose maybe 20, 25 these records, and then you can look at it. Then we also explore your attitude by working at junior level, especially if you're going for MTI posts. So a lot of time, people who are very experienced, they are applying for MTI posts, and we tell them that, okay, you will be working with a junior registrar who is probably 1/3 of your age and experience. So you will be her junior. How will you feel working at that? And we want to see, because there are people who have got big egos, and if you have got big egos, you will be fighting with the junior registrar every day. Yes, if you are able to work harmoniously, you would be able to offer them your experience, and they would be able to tell you experience of working in NHS or the health system. Then another question which comes, strengths and weaknesses, and that's a very interesting one. I learned a lot by looking at medical students. Like they asked somebody once that what is your hobby, and she said that I do rowing. Okay, so they said, okay, how does it relate to ops and gynae? So have you ever thought of this question? Or somebody's hobby is cooking, and then they say, okay, how does it relate to ops and gynae? And the way these young medical students, they twist that whole answer, that's really interesting. That you just need to bring in all the positives which can go towards the ops and gynae, and then strengthen your answer. Similarly, for the other bit, the weaknesses bit, so do not give anything that which is a negative point. So you should be giving an answer which could be for something which is negative, but conveys a positive. Like a lot of people, they have a very typical sort of answer that, okay, I cannot say no to people, and it can be a bit difficult. So these are those things that take time to think about it. So you should have thought about it beforehand. And if you start thinking like that, write it down on a piece of paper with your real life example, then it will be very, very beneficial. Like this rowing one, I was saying that she mentioned that, okay, because it's a teamwork, so we are rowers are together in a boat. There are 4 people, we are all rowing together. And ops and gynae involves multidisciplinary team working with midwives, with neonatologists, with anesthetists, and it was a very good answer. Then another question is, sometimes things go wrong at work, how will you deal with it? There are people who will answer and say, I go home, I sleep, I listen to the music. Now, the question is asking about this, but it doesn't mean that they want to know how you are dealing with that to relieve that stress. But in fact, what they want to know is that how will you deal with that you will reflect on it. You will think why it has gone wrong, not that Allah ki marzi thi aise ho gaya, to bas theek hai, isko thap ke rakh do. So you have to think like that, okay? And then you will discuss with your senior, you will discuss with your education supervisor, clinical supervisor, write down a reflection so that you do not make the same mistake again. Then towards the end of the interview, we ask questions about family. It's not that we are nosy and we want to know how many wives you have, how many children you have. The purpose is to see if you are planning to come to UK, or you are going to go into this job. So will you be able to settle in? Because it could be that the job requirement could be that you are starting at 7 o'clock and you say, I've got children in the school, and schools, they don't open till 9 o'clock, and then you have to arrange for childcare, and your husband is working somewhere else. So all those things. So it just gives you an idea how things are. It's not that people are going to reject you based on that, but they will discuss with you, okay, these are the issues. So have you envisioned how you are going to do that, how you are going to organize nurseries and all that? And at the end, we ask them to invite if you have any questions, please ask us. This is also, it just reminds me that in RCOG Part 3, sometimes when our candidates, they go, because English is not our first language from Pakistan, so they are practicing in English for the first time. And there are times that candidates for Pakistani MRCOG Part 3 candidates, I've seen them saying to the patient, how should I ask you this question? So you are asking the patient, actually, they are trying to tell the patient, okay, I want to ask you this question, but it is flip it around. So just think about it and be a bit clear about that. And that just brings me to the end of that. So you need to have leadership skills as well, and we will talk about it some other day. And this leadership, it doesn't involve all these admin groups. Okay, so any questions? I'm happy to take any questions now.
So we have noted the questions from the chat, and I should request Dr. Waseem to respond to them. So the question coming in is, if I have a GMC registration, the non-PLAB route, and working in Pakistan, am I still eligible for MTI?
I think you would be able to apply for MTI scheme. What I need to advise you, if you go on RCOG website, everything is there. As I said that I cannot cook all this halwa for you and spoon feed you for that. So every information is there. If you are interested, go on RCOG website, because there are things, I don't want to give you wrong information, okay? Because you need to have up-to-date information. Things change. I might tell you something today, it might not be valid tomorrow. So the best thing would be that you should be able to look at RCOG website. My feeling is, because if you've got GMC registration already, then you should not have any problem. And you should be able to go for MTI scheme.
So thank you very much, Dr. Waseem. I really appreciate that you took out time, and I really admire you sharing your experiences. It takes courage to share the bad experiences from where you picked up and you improved yourself, and it actually reflects on the passion as well that there are two ways. If you've had a negative experience, the one response would be that you would be negative to other people as well. But the other one is that something bad happened to me, or something bad was not up to the mark was done by me, but now I don't want others to repeat that mistake. And I generally follow the second school of thought, and I can see that very much reflective in your talks. You follow the same, and I much appreciate it. And secondly, yes, the way we project ourselves, that is very important. And I also keep on telling all our residents that, your organizational skills are visible the moment somebody looks at you. Obviously, the looks doesn't mean that you have to be super beautiful or super, extravagant dressed up, but just neat and clean, organized, and the way you sit, the way you talk, and the way you start your conversation, that actually reflects on your overall organizational capability as a person. And then that is actually visible when you start taking that interview as well. So really grateful to you for your response, and looking forward to have further collaboration regarding the workshops in future. And I just say, Dr. Arush, to say a word of thank you. And before we conclude, this session will be recorded, Dr. Waseem. It has been recorded actually, and will be shared with the participants for a wider audience to get benefit from this talk.
Thank you.
Yeah, so I shall thank Professor Dr. Waseem Lodhi for his valuable time in sharing knowledge with the
Sorry, Dr. Aruj, I'm not professor, by the way.
Okay, sorry. Yeah. So candidates, kindly do fill the feedback form, and please stay updated on the IRC RCOG page on the Facebook for the recording, which will be uploaded by Monday, and stay updated for the upcoming academic sessions as well. Thank you all.
Thank you.